Isn't it common that people, as they start to get better, first there's a flare up before it clears out?
Many times, yes, there's a flare-up. Now, people have got to understand this. That's part of the healing process in some cases. Not very often, maybe 10%.
Mm-hmm.
They call it the Herxheimer reaction, in which the patient flares from head to toe, and it's the most difficult time, not only for the patient, but for the doctor,
Mm-hmm.
as well as the parents, if it's a case of a child. You got to get through it. The main thing to do is prevent dehydration. Drink plenty of water, cool the skin down as much as you can. I've had severe cases of it that held to it long enough until they see the breakthrough.
How long does the flare up usually last, and how soon does it start? What can somebody generally expect?
See, once they're on the regimen, it may start within a week.
Mm-hmm.
You know, in some cases it didn't happen to 2 or 3 months, but it just indicated that the body had to purge these toxins. And that's what it's doing. It's throwing the poisons off right through your skin. And you have to hang in there. Just follow the diet, but hang in there. Keep it cool as much as you can till you get through this period, and then you'll start seeing the white coming through. White new skin. And then you follow on through with that, and then you'll see it heal like you never dreamed possible. So that's what happened to her, and then she got back on target again. See, I could never promise a patient that it'll never come back. But I can promise them, once they clear up, they'll never fear it again. And that was one of the major things, is people fear it. Where am I going to go from here?
Mm-hmm.
If they stayed with it medically, they're usually on it for the rest of their lives, that they have to keep taking this drug of one kind or another. And there's a million of them out there. So, but if they heal this way, they're in control, and that's the difference.
Mm-hmm.
And the other good news about it is they never felt better in their life. Once they get on it, you'll lose weight that you don't want.
Mm-hmm.
And especially children, they respond beautifully, usually very quickly. Children respond very quickly. I'll give you another example of how quickly you can respond. Now, here's a man who's had it this way. See that? He's had that
Painful.
6 years. 6 years he's had it this way. He's been all over treatments. He came to me, and he came in every week. Here he is in 6 months.
Wow.
See? 6 months. Never had to see him again. Once my patients clear up, I rarely ever have to see them again.
They
See?
just forget all about you?
No, no.
After you were so helpful? I didn't forget
oh,
you.
Tell me.
I'm loyal.
Okay. That's the only reward I want. Here's another patient of mine. This is the way he looked when he first came in. And here he is, but it did take a little longer. It took 9 months to go from here to here. 9 months.
Mm-hmm.
See? Now, what also helped this man was part of the treatment is when they have certain baths. And he went to Iceland, to the Blue Lagoon. And he went there for the deeping of the bath before the volcanoes, of course. And he came back that way and never had to see him again either. He's always in control, always in control. They know what to eat, and they know what not to eat. Knowing what not to eat is one of the biggest, most important factor, what not to eat.
What was the longest a patient had psoriasis before coming to see you?
I would say, yes, I remember it very clearly. She was a patient who came in from Hartford. She was the longest running and most severe patient that they ever had at the biggest psoriatic center in Connecticut. She was being treated there for 28 years. She came into my office because someone gave her my book as a gift. And she said the minute she looked at the book, this is the book. The minute she looked at the book, she knew that it was the answer to her problems. And she started in. That woman had it so badly that was all over her body. She was 250 pounds to begin with. but she never stopped working. She used to tell me that when she would drive home from work, it would take her 15 minutes to get out from behind the wheel of the car, just to turn to get out, because the skin would crack, split, and bleed. She was the most severe case. It took 2 years. It was a 2-year period.
Did she come to you, or she actually just used the book?
Oh, no, she came to me. She came to me.
Mm-hmm.
She lost, by the end of that time, she lost 100 pounds, which is much closer to her real weight. And she acted as my model when I gave a big lecture at the Fort Lee Historic Park Museum. She came in from Hartford in order for the people, and they just loved her for it. So that was the longest running. However, the shortest running case, which has never happened before nor since, was a man. I call him in my book, I call him Mr. A. He came into me, and when he took his shirt off, I actually said to myself, who am I to think that I could help this man? It looked like he had literally a coat of armor all through. That's how thick the scales were. They could become 9 times the amount of thickness of ordinary skin.
Oh my gosh.
9 times. And
9
I
times?
almost didn't take him. Yeah. I almost didn't take him as a patient because I didn't want to disappoint him.
You have to get over that. That seems to be a running theme.
I know,
You feel
but
responsible, but
sometimes. But you see, it requires 2 things: my knowledge and ability, and also the patient's dedication.
mm-hmm.
I call it three Ds. I call it the 3 Ds: diet, detoxification, and determination. Now, if one of those are missing, you may be working hard to get them well, but if they're not determined to get well, you're fighting a losing battle.
Mm-hmm.
So I wasn't sure whether he would follow through. You know how long it took me to clear him up to the point where he had skin like a newborn baby. Not a mark, not a scale on him. Literally. And he had it for 30 years. 30 years he's had it. He was 65 at the time. It took 30 days.
Oh, that's it?
In 30 days, he had a whole new skin.
Wow.
Mm-hmm. So that shows you. And it was all diet. Like when I asked him, what do you think was the cause of your problem? He said, I know what it was. He used to love to have big chunks of beef in a big skillet with fat. And he said, I love it. He said he eats it 5 times a week. And he stopped that. Cold turkey. He just stopped it. The first thing that gave him relief from the itch that took place was sodium bicarbonate baths. In other words, they'd fill the tub with lukewarm water and put about 1 pound, maybe 2, of sodium bicarbonate. Just pour it in there and sit there. And that would alkalize the outer surface of the body. And he said that helped the itch that was driving him crazy. And then he followed my diet, the Casey Pagano diet, they call it. Anyway, he did that, and in 30 days, he didn't have a mark on him. And he appeared before my patients to help encourage them. There's nothing like that. Nothing like seeing a person who went through it, and here are my results. So you see, there's a way out. There's a way out for these people. They don't have to live with this disease if they're determined. But they have to remember that if a flare-up occurs, that is literally part of the healing process. Sometimes there have been 1 or 2 occasions, remember I've been doing it for 40 years, 1 or 2 occasions where they had to be hospitalized, and fortunately the doctors went along with me, and they had them on intravenous to prevent dehydration, but then they got over that, and they got back on the diet, and we pulled them right through.
Mm-hmm.